Welcome to week one of your Nursing with Concepts and Theories course. Each week I'm going to try and do a video for you because I know some students like to have more of a verbal explanation and see the professor rather than just seeing what is needed written down. So let's look at your discussion board for this week. First thing I want you to do is introduce yourself to the rest of the group. Just kind of helps us become more of a community of students and you realize that you're not in this whole thing all by yourself. In the discussion post, after you introduce yourself and tell us, something about you personally or professionally, then I want you to describe why nursing theory is important to today's nursing practice. A lot of times we don't think about nursing theory as we're working on the floor. I also want you to talk about how would you select and introduce a nursing theory or model into your nursing practice. I spent 20 some years working in a chemical dependency facility, and I can see Gene Watson's theory be used in that facility all the time. It centers around love and caring, and that's really what a lot of these patients need to help build them up. So that could be implemented all the time in my facility. So think about some of those other theories that could be implemented in your facility and give us some examples. Then, for your assignment, you are given a case study, and I'll let you read the case study on your own, but then you need to answer some questions in your paper. So, looking at the case study, use Nightingale's environmental theory. Which actions would the nurse take upon the first assessment? So as the nurse walks into the room, some of the first things that you notice related to Nightingale, um, cleanliness, light, odor, sound, any of those things. What can we begin to realize needs to change in the environment to make this patient's life better and more healthy? What are the 5 essential components of Nightingale's theory? So you can go ahead and list them in your paper. Prioritize an appropriate care plan for Mrs. Adams. So think about things that we can do while we are there. I know sometimes students want to make referrals, get social services involved, but really think about what you can do while you're there to help her in this environment rather than making referrals, which is going to delay some of the things that she needs done. Okay. Apply Nightingale's theory to an area of your nursing practice. What patient population would benefit from this approach, and support this practice change with at least one evidence-based article? Evidence-based means less than 5 years. So you need to find an article that you can um, that will support your position, and it needs to be dated less than 5 years. Anything outside of that is APA considers outdated information. And a lot of times we realize that even in the nursing field, things change, things evolve, and we need to keep up with those changes. So with providing a practice change or a practice environment, be specific. Like what might you do on an oncology floor? What might you do in a surgical environment? I don't want you to give me a generic example because we can apply her to um, any patient population. And sometimes students will write that, well, this would apply to floor nursing. Be more specific than that. Talk about surgery. Talk about maybe a psych unit with sound. Talk about oncology with cleanliness and things like that. So do provide some examples. Now, as far as some expected things with this paper, the assignment should be completed in APA format. So I expect a running head, page numbers, title page, all of that. Don't just start out with your paper. It needs to be in essay form between 1,000 and 1,500 words. The paper should include at least 2 outside references and the textbook, so you need a total of 3 references for this assignment. The paper should be in APA format with a title page, level headings, and reference page. I do, for the papers, attach a shell to this news bulletin, and I will also upload it into the specific module for that week. So take advantage of those. Those are set up. Students still struggle with just setting up an APA shell sometimes. So take advantage of those because the level headings are in there. And I do expect you to have level headings in your paper. First person is not acceptable in APA papers. The only time I allow first person to be used is if the paper is more reflective in nature. Otherwise, I expect you to use third person. If you have any questions, please don't hesitate to reach out for me or to me. We are here to help you succeed. So email is always best, and I usually try and get back to you in a very quick, timely fashion. But otherwise, at night, when things settle down in my house, I usually look at my emails and catch up on things that maybe needed a lengthier answer. All right, good luck.